Hello everyone, welcome to my channel. This is Dr. Bia Fatima and I hope that you all are doing great. Today's topic is infant gas and I'm going to talk about how you can prevent it and treat it. So let's get started. Why are some babies so gassy? So, infants are usually gassy because they have immature digestive systems and swallow air during feedings. Some babies may have sensitivities that could be affected by a breastfeeding mom's diet or a certain type of formula. During digestion, bacteria in the large intestine breaks down the unabsorbed food particles, releasing hydrogen and carbon dioxide and producing small bubbles of gas. This gas can cause discomfort if not passed out. If you suspect that your fussy baby is genuinely uncomfortable and they keep squirming and pulling up their legs, they might have some gas that refuses to pass. The best way to confirm this is to try some gas relieving techniques. If your baby seems much better after passing gas, then that's a telltale sign that the problem was gas. Now let's talk about how to help your baby feel better. First, know that infant gas can happen in both breastfed and bottle-fed babies. You can take some of these steps to prevent and ease the pains. Number 1, check feeding position. When you're nursing or bottle feeding, try to keep the baby's head higher than her stomach. That way the milk sinks to the bottom of the stomach and air goes to the top, and it's easier to burp out. Tip the bottle up slightly so there are no air bubbles in the nipple, and use a breastfeeding pillow for support. Number 2, burp your baby. One of the easiest ways to ease gas pains is to burp your baby during and after each feeding. If the baby doesn't burp right away, lay them down on their back for a few minutes and then try again. Number 3, change equipment. If you're bottle feeding, switch to a slower flow nipple. And if you're breastfeeding, be sure that your baby is latched properly. Number 4, work it out. Yes, I'm talking about infant massage. Massage might help your baby relax enough to pass gas. Next is the baby bike ride, that is pumping legs back and forth while the baby is on their back. Also encourage tummy time. Tummy time is good for strengthening the muscles your baby needs to lift his head and eventually to crawl and walk. But the gentle pressure on baby's tummy can help relieve gas too. Also, you can give the baby a warm bath. These are all ways to help your little one get rid of extra gas. The 4 things I mentioned and work it out: infant massage, the baby bike ride, the tummy time, and a warm bath. Try them all out. Number 5, experiment with foods. Talk with your pediatrician about foods that may cause extra gas. Your doctor will make sure you don't remove needed nutrients from the baby's diet. Some babies may also have trouble digesting foods that come through breast milk, such as milk products and caffeine. If you're formula feeding, talk to your pediatrician about switching brands. Some brands claim to be helpful for gassy babies. Number 6, consider over-the-counter treatments. There are many available, but you need to check with your doctor or pharmacist before using one to make sure the drug won't interact with something else your baby is taking, that the baby isn't allergic to anything in it, or that you give the correct dose. You can try these over-the-counter remedies for infant gas, but there's no clear research that they work. For example, the gas drops that contain simethicone and also gripe water. You can try probiotics as well. Probiotics are bacteria that support your GI health and are also naturally present in some foods. They're generally considered safe, but be sure to talk to your doctor before giving your infant any probiotic product. Now let's talk about infant colic. What is infant colic? During the first 4 months of life, colic is defined as crying for 3 hours for more than 3 days a week for more than 3 weeks. That's the definition. Gas does not cause colic, but colicky babies may swallow more air, giving them more gas. Now, when should you worry? Contact the doctor right away if your baby has any of these symptoms. Number 1, constipation, bloody stools, or vomiting. This could mean a serious digestive problem. Number 2, extreme fussiness. If you can't get your baby to calm down, then the baby needs to be checked by a doctor. Number 3, fever. If your baby has fever, a doctor needs to rule out infection. Remember, infant gas is normal and treatable. As your baby's digestive tract grows, the gas will become less of a problem for both of you. I hope this video was of help. If you liked it, please give it a thumbs up and subscribe to my channel for more videos. Thank you so much for watching and take care. Bye bye.